Hello and welcome to this video from the Ruth Lilly Medical Library. In part 2 of the overview of medical research study designs, we'll cover different types of observational studies. After watching this video, you'll be able to identify the main types of observational studies and to describe the basic features of how those studies are run. In part 1 of this series, we talked about the study types you find in the upper portion of the evidence pyramid. Now we're going to move to the lower section to discuss observational studies. We're moving to the right side of this diagram where the researcher is not assigning exposure. That is, they aren't creating groups where one takes a certain medication and maybe the other takes a placebo. An observational study is one where the researcher is simply observing what the participants are doing or what they have done. If there's a comparison group, such as maybe smokers versus non-smokers, we consider that an analytical observation study. If it's not, or there's no comparison group, it's simply a descriptive study. The three main types of observational studies are based on directionality of what you know and what you're trying to find out. We'll get more into this in a minute. We're going to go over these four main types of observational studies: cohort, both prospective and retrospective, the case control, a cross-sectional, and we're going to end talking about case reports and case series. So we'll start with cohort studies. With a cohort study, a group is assembled at some sort of common point in time. This group may be based on a common profession, such as the Nurses' Health Study, or geographic proximity, such as the Framingham Study, or something else entirely. We know the exposure of interest, such as maybe those who are adhering to a plant-based diet. What we don't know is what's going to happen to those people. The outcome is unknown, and that's what we want to learn about. In this case, maybe we're interested in the impact of plant-based diets on cardiovascular disease or longevity or maybe even mental health. A cohort study can be prospective, meaning it moves forward in real time, or retrospective. Usually we're doing these based on medical records. And here's an example of a research article looking at basically this very topic using a cohort study strategy. So how are cohort studies run? Well, you start with your cohort here, and then you identify the subjects who've had the exposure of interest. Again, maybe we're looking at plant-based diets versus those who are meat eaters, or maybe we're looking at smokers versus non-smokers. Then you follow them forward through time and determine if there's any statistically or clinically significant differences in the outcomes between each group, whether that's, again, cardiovascular disease or cancer or something else. We are moving forward through time even with the retrospective cohort studies, and we're trying to answer the question, what will happen? So with cohort studies, we know the exposure, but we don't know the outcome. Flip that around and you have a case control study. We start with a known outcome, such as maybe Alzheimer's disease, but we don't know what caused the outcome or what we call the exposure, and that's what we want to learn more about. Maybe our theory is that H. pylori could be causing Alzheimer's disease, or those who have had traumatic brain injury are more likely to develop the disease. A case control study is always retrospective. We're always looking backwards in time. And here is an example of a research article that used a case control methodology to study this very example. We start case control studies with cases, those who have the outcome or the disease. We then match those cases to controls who are as similar as possible to the cases, but they don't have that particular disease. So maybe with Alzheimer's example, we match based on age and gender, ethnicity, geographic location, as many things as we can, but the controls just don't have Alzheimer's. Then we look back in time to try to figure out which exposures were more common in the case group versus the control group. With a case control study, we're looking backwards in time and we're trying to answer the question, what happened to cause this? Keeping cohort studies, both retrospective and prospective, and case control studies straight in your head can be challenging, so let's work through it again. A prospective cohort is the easiest to understand in that the researcher knows the exposure. Again, that's the behavior or what we already know, such as if you smoke or you don't smoke. And the researcher starts the study to learn about the disease or the outcome. And again, maybe that's cardiovascular disease or congestive heart failure or cancer or something else. In a retrospective cohort, the researcher also starts in the present, but is looking back in time, generally using medical records. Known and unknown elements here are still the same. We know the exposure, again, maybe that's smoking or something else, but we don't know the disease. The difference is that we're using the medical records to follow this person or group of people through time to learn about what that outcome is going to be. With a case control study, the research team starts in the present, but they know the disease. They know that outcome already. What they're doing is looking backward in time to try to figure out the exposure or what caused that disease. And here's the key for this diagram if you find it helpful. Another type of observational study is the cross-sectional study. These have no directionality. They're only looking at what's happening right now. The exposure and the outcome are measured at the same time, such as maybe we're looking at levels of chocolate consumption and stress in medical students. Surveys are one of the most common ways to run a cross-sectional study. And in this one, it's really easy. You've got the subject selected for the study. You determined who has the outcome and who doesn't. And the onset of the study is basically right now. There's no direction of inquiry. We're just trying to answer the question of what is happening right now. The final study type included under the observational banner is the case series and case report. These are wonderfully easy to understand. A case series is a description of a series of patients with some similarity in how they were cared for, and a case report is a description of an individual patient and the management of their care. These are written when there's an unusual presentation or something new or novel appears. Most medical students are familiar with these because they're one of the more manageable ways to get something published or to do a presentation during your medical school career or you're early in your residency. But they can also be useful for clinicians who see something unknown and want to see if anyone else has had a similar patient and how it was handled. So observational studies are a great way to study things that don't lend themselves to interventional studies like randomized controlled trials, but they're lower on the evidence pyramid for a reason. Without tight control and randomization, we can only identify associations, such as those who have experienced traumatic brain injuries may be associated with higher odds of developing Alzheimer's disease, but we can't say that it causes it. Remember that correlation does not equal causation, and that's very important when reading observational studies to keep that in mind. So while observational studies are lower on the evidence pyramid, they're an important part of the medical research landscape. Knowing the basic features of these studies will help you read and apply the research more effectively. Thank you for taking the time to watch this video, and please reach out to the Ruth Lilly Medical Library if you have any questions.